So I want you to picture an operating room where a surgeon has an AI co-pilot and maybe even a form of X-ray vision. Sounds like something out of a movie, right? Well, that's not science fiction anymore. It's what's predicted for 2025. Today, we're diving into the biggest surgical innovations that are completely changing medicine, all based on sources that were carefully reviewed and evaluated by Dr. Reza Lankarani, who's a general surgeon and the founder of the Surgical Pioneering newsletter and podcast series.
You know, that one quote really says it all, doesn't it? We're on the brink of this incredible transformation. Technologies that felt like pure fantasy just a few years ago are now becoming real, practical tools that are redefining what's possible in medicine. So let's get into it.
All right, we're going to start with the invisible intelligence that's giving surgeons a huge boost in precision, artificial intelligence. Now, this isn't about replacing surgeons, not at all. It's about giving them this incredibly smart co-pilot. And it all starts with how they see and understand what's happening during a procedure.
Get a load of this number, 92.8%. That is how accurately computer vision can now watch a surgery live and identify every single step. And that's not just, collecting data, that is the AI understanding what's happening in real time. That one capability right there is what unlocks this whole new world of surgical guidance.
So, how does this actually play out in the OR? Well, the system grabs a patient's scans, like an MRI or a CT scan, and it uses them to build this super precise 3D map of the patient's body. Then, as the surgery happens, it tracks the surgeon's tools in real time and overlays this guide, kind of like a GPS, so the surgeon knows exactly where they are and what's next.
And the impact is immediate. I mean, even before the first cut is made, this AI navigation is making everything smoother. Look at this. Prep time for some really complex surgeries drops from almost 66 minutes down to just over 51. In the OR, where every second counts, saving that kind of time is a really big deal.
Okay, so if AI is the new brain in the operating room, what about the hands? Well, technology is now stretching a surgeon's physical abilities way beyond normal human limits, giving them what you could almost call superhuman senses in reach. It's breaking down the old barriers of both distance and scale. Just think about this for a second. A top specialist in Dubai could perform a really delicate operation on a patient who's all the way in Orlando. That's over 10,000 kilometers away. New 5G technology is making this happen with a delay of just 73 milliseconds. That is literally faster than you can blink, and it's well within the safety window for surgery. Amazing.
And then if we go to the other end of the scale, the microscopic end, we have nanorobots. These are tiny, tiny machines, just 1/20th the size of a red blood cell. Seriously. They can be guided by magnetic fields to travel through your smallest blood vessels, to deliver medicine, or even make repairs on a cellular level. It's just mind-bending stuff.
Now, I know what you might be thinking. Nanobots, remote surgery from across the world, it can sound a little out there. And it's so easy to get lost in the hype, which is why having an expert guide through all this is absolutely critical. To sort the science from the fiction, all the sources for this explainer were evaluated by Dr. Reza Lankarani. His insight, which he also shares on the Surgical Pioneering podcast, is what makes sure we're focusing on reliable, verified breakthroughs.
So, beyond more brain power and a longer reach, technology is also changing what surgeons can see. We're talking about giving them a kind of digital superpower, letting them look right through skin and bone to see what was totally invisible before.
You know that classic sci-fi idea of X-ray vision? Well, augmented reality is basically making that a real tool in the OR. An AR headset can project a 3D hologram of a patient's own anatomy, their spine, their organs, their blood vessels, right on top of the surgeon's view of the actual patient on the table.
And check this out. This isn't just a theory or some cool tech demo. It's already being used, and it's proving its worth. Surgeons using these systems are reporting 85% satisfaction with the image quality and 84% with the accuracy of those virtual overlays. So it's not a future gimmick. It's a tool that's making surgery more precise right now.
And this whole technological revolution, it continues all the way down to the most basic things. The tools a surgeon actually holds in their hand, and the materials we use to help the body heal.
Okay, take a standard set of surgical tools. A traditional one made of stainless steel can cost a whopping $50,000. But now, With 3D printing, hospitals can create custom tools for specific procedures on demand, using medical-grade polymers. This means huge savings and a lot less waste.
And this is just incredible. Even the humble suture, a tool that's been around for centuries, is getting a massive intelligence upgrade. These smart sutures can actually monitor a wound for infection, detect any leakage, deliver medicine exactly where it's needed, kill drug-resistant bacteria, and even send updates wirelessly from deep inside the tissue straight to a doctor's phone.
We're going to end on what might just be the most profound shift of all. We're moving away from just repairing the body to actively regenerating it, using the body's own natural building blocks to heal itself.
By taking a patient's own stem cells and using them with advanced new materials, surgeons can actually reconstruct bone and other tissues. And the results? They're simply stunning. Studies are showing patient satisfaction rates hitting 90 to 95%, with way better outcomes, like less scarring, when you compare it to the old methods.
And maybe the ultimate frontier in all of this is the brain-computer interface, or BCI. Now, we're in the very, very early days here. Fewer than 40 people in the whole world have one. But this technology holds the promise of restoring function by allowing direct, thought-based control of things like robotic limbs.
So, when you pull back and look at the big picture, what does all this mean? All these individual breakthroughs, the AI, the robotics, the smart materials, regenerative medicine, they're all coming together, and they're all pushing us toward the same goal. A future where surgery is safer, more precise, way less invasive, and more accessible to everyone, everywhere.
Which of course leaves us with one last really big question. As these incredible machines and AIs get more and more capable in the operating room, what's the one thing we can't engineer? What is that irreplaceable human element that will always be essential?
And before we go, we just want to give a final huge thanks to Dr. Reza Lankarani. As a general surgeon and editorial board member of the Genesis Journal of Surgery and Medicine, his expert evaluation was absolutely essential in helping us navigate all these exciting, complex advancements.
If this has sparked your curiosity and you want to go even deeper, you absolutely should. You can explore these topics and a whole lot more on the Surgical Pioneering podcast series application. You'll find it at the link you see right there on your screen. Thanks for watching.